So once again, my name is Dr. Michelle Meade. I am the director of the U of M Center for Disability Health and Wellness, a rehabilitation psychologist, and a professor in the departments of physical medicine and rehabilitation and family medicine here at the University of Michigan and Michigan Medicine. Our website is here. This is our special vanity link, mishmed.org/disability health. What we, I guess, really, let me see if I can get this, went over today, or the purpose of this conference is, has been changed over the years. And at this point, we really want to use it as an opportunity to provide research finding back to participants. We could not do this work without the people who are part of our study, who trust us to be listening to their voices, to use their time and their input and their experiences in a productive way. And we want to make sure that they know both our appreciation and what we found. And so we wanted to keep that mechanism and loop back and provide an accessible way for that to happen. We also want to increase awareness among one another about the research that's going on and to enhance a sense of community. We want to encourage collaboration, both with one another and with people with disabilities. This isn't about a competition. It's not about who finds this information first. It's about how we find similarities between what we're doing or our processes and procedures and build on what we're doing and learn to better apply this and implement our research and translate it to improve the lives of individuals with disabilities. And for me, to really improve healthcare for people with disabilities and their families. Where this particular conference is about teaming together. And so we heard on the themes of what does disability mean and who identifies having a disability and why. What does society see and understand about disability? And we talked about ableism and how that really may impact people from accessing resources or being connected or learning about or using the tools that may enhance their opportunities or their access to things. We talked about the important, how do we improve the health and healthcare for people with disabilities, and really the importance of partnering with people groups and in different settings, particularly in community research and healthcare and education settings. We know when we found out that people with disabilities experience pneumococcal disease and pneumonia, as well as most chronic conditions at higher levels and at younger ages than the general populations, and that this information has to be integrated into our guidelines and protocols and the best practices, the standards and the training for our primary care and other providers. We know that we heard that healthcare providers sometimes know how to treat medical issues among people with disabilities, but often don't know how to handle the social aspect or the psychological. And so we really look again to the importance of working with communities, reaching out to our colleagues in allied health, psychology, social work to help identify and advance mental health, to help provide resources and supports. We know that it's critical to listen to the lived experience of people with disabilities and the healthcare for healthcare providers to engage with them and their families for shared decision making. This is going to allow for better outcomes and for problem solving. And that education, including interacting with people with disabilities and participating in adaptive sports with them, can all help trainees and clinicians enhance awareness and really respect, I think, both for the lived experiences and for the abilities of people with disabilities. Once again, the idea that everyone's human, and if we can connect with that humanness and what's similar and how to work together to improve outcomes, it results in better outcomes or awareness for everyone. I do want to mention some of our upcoming events. The CDHW is now partnering through our AHEAD DC, RRTC, with Blue Cross Blue Shield of Michigan, and offering disability healthcare access and quality grants to safety net organizations. These are usually identified as clinics and organizations that provide healthcare or dental care to people with disabilities or to the public with limited or no health insurance. And so these grants, which are up to $10,000, are to improve access and the quality of care, specifically for people with disabilities. We've been partnering with the Disability Network of Washington, Monroe, and Livingston in terms of helping to provide education to those groups. And we've really been met with enthusiastic outcomes and participation by those providers and clinical staff. Once again, I think these healthcare providers, they want to know how to provide the best possible care, and we want to provide a way for them to do so. So please be aware that those are coming up. The grants open on November 3rd and they close on January 16th. That's just for the state of Michigan. And there may be other requirements that come out. So check our website. We have our monthly research seminar that is available through registration for people who want to be part of our community, who want to talk and think about research methodology and how it needs to change and how we need to adapt it to appropriately capture the perspectives and voices of individuals with disabilities, without limiting, or without that approach limiting who we get or our understanding of results or those experiences. We have technical assistance and office hours that were mentioned earlier. Those are on the second Thursday of each month at 10 a.m. We have a MLK Day panel happening in January, our disability healthcare and health provider training in April. And in October of next year, we're going to have our Disability Health Fair and Research Symposium over 3 days at Washington Community College. And so we have many upcoming events. Once again, we're trying to do more in collaboration. We want to make sure both to engage the disability community, provide direct information and services and support for people with disabilities, while also connecting and enhancing access to resources for healthcare providers and resources. I want to thank India Foy, Andy Brosius, and the entire team, my colleague Michael McKee, all the presenters and discussants, and everyone who attended and was part of this conference. We keep growing. It allows us to connect, and please keep submitting in the future. Keep thinking about how you want, and please remember to complete those follow-up evaluations. This really does shape how we offer and what we offer in these in this particular format and discussion. So once again, thank you very much for being here, and I hope you have a good weekend. Bye-bye.